Hello, everyone. May is Melanoma Awareness Month, so we wanted to share some information with you about melanoma. So melanoma is a cancer of melanocytes, which are cells that are most often found in the skin, and they produce the pigment melanin. The most common type of melanoma is a cutaneous melanoma, or melanoma of the skin, though we can also have melanomas that arise on the hands and the feet. Those are called acrolitiginous melanomas, or in the eyes, uveal melanoma, which is a less common subtype. Cutaneous melanomas, as I said, the most common type, they tend to happen in people who have fair skin and light-colored eyes. Other risk factors include a history of sunburns, particularly blistering sunburns in childhood, and also a family history of prior skin cancers. Bermudians are at higher risk than in most countries because we get a lot more sun here, and so that puts us at increased risk, and therefore we have to have a higher level of awareness about melanomas. Melanoma treatment, for the most part, when we are able to find them when they're small and localized, is surgical. So that can be done by dermatologists, sometimes here on island. Sometimes we have to send people away for specialized surgeries overseas, particularly if they arise on the face or somewhere where the skin is more sensitive, or there's or the cosmetic outcome is more important. Moreover, when people do have melanomas that are advanced or that spread to lymph nodes nearby, we can treat them with something called immunotherapy to improve the likelihood of cure and reduce the risk of them having a recurrence. And that's an innovation in the past 5 to 10 years that's really improved outcomes for melanoma. When melanomas do spread, if they become metastatic, we have access here on island to state-of-the-art immunotherapies that we use routinely here in our treatment facility. And in some cases, we can even refer people overseas for a new treatment that was approved in the last few months by the FDA in the United States called TILS therapy, which actually uses T cells, a type of immune cell, to attack the melanoma. So they take them out of the body, they train them to attack the melanoma, and then they infuse them back in. And this combination of new therapies has really transformed the way we treat it, and thankfully we've been able to get all of these treatments for Bermudians. Finally, as it pertains to prevention of melanoma, which is the best thing we can do, it's really important to do things like wear clothing that has SPF protection, wear sunscreen every day, year-round ideally, and if you're in the water or playing sports, you should really be reapplying it every 2 to 4 hours. In addition, for people, particularly those at high risk who have, as I said before, fair skin, history of sunburns, particularly blistering sunburns, or family history of skin cancers, they should really be seeing a dermatologist on a routine basis. And finally, if you have a skin lesion that shows up, particularly if it's changing over time, you should really see a dermatologist with urgency, because if it is a melanoma, we can cure it as long as we find it early.